Hello, and welcome to our webinar Wednesday presentation, No Pain, No Gain, Avoiding Workout Myths and Injuries. We're here at our Fort Bend Medical and Diagnostic Center in Sugar Land with Dr. Anup Shah, and today he's going to debunk the infamous myths that haunt the workout world. A little bit of information, actually a lot, about Dr. Shah. Dr. Shah joined us in last October, and we're glad to have him here. He completed his internship and residency at UT Health Science Center in San Antonio. His first fellowship was completed in sports medicine at Baylor College of Medicine, but he didn't stop there. He went on to cap off his education in orthopedics with a shoulder and elbow reconstruction fellowship at Harvard Medical School. An interesting tidbit about Dr. Shah, he's probably worked with a few of your favorite athletes. During his Baylor residency, he worked with the Texans, Astros, and Dynamo, and he's also the former assistant team physician for the Atlanta Falcons and NHL Atlanta Thrashers. Something you should know, feel free to submit your questions during the webinar as soon as you think of them. Dr. Shah will answer them during the Q&A session at the end of the presentation, and that's when the big giant slide with questions pops up. So feel free to go ahead and do that. And now here is Dr. Shah.
Thank you, Valerie. Good afternoon to those of you joining us. I want to preface this presentation by clearly stating that a lot of these things are probably things you already know, and the whole point of this presentation was really to reiterate some of the important facts, but also to really do away with some of the myths or some of the false perceptions people have about working out. So to start off with, the first myth is if you aren't sweating, you're not working hard enough. This is just absolutely not true. Sweating is your body's way of actually cooling itself. This does not indicate the amount of exertion that's going on, and it is true to burn calories without breaking a sweat. We do this every day. One of the interesting facts is that the U.S. Department of Health recommends that you get 2,000 calories a day. And the reason why they state that is because just by doing your activities of daily living, you're burning about 2,000 calories a day. Next, cardio exercises should be done before strength training. There's really no correct order to do various exercises. Whether you do your cardio warm-up first or second doesn't really make a difference. However, I will say that if your goal is truly endurance, you should probably do cardio first. If building is your priority, then strength training should probably go first. This gives your body the energy to focus on the main target. What's important is to get enough types of exercise. What's important is to get enough of both types of exercises every week. A lot of people have asked me if I focus on a certain part of my body, can I lose weight specific to that part of the body? Well, unfortunately, this is not really true. Whether you're a male or a female, most sexes want to target certain areas, but spot reducing is really a myth. You can't really target specific parts of your body for weight loss. However, you can target certain spots for muscle building and strength training. In order to lose fat or adipose tissue, you have to perform regular physical activity that really works the entire body. Another question I get a lot is, Doc, when's the best time to work out? I've heard it's in the morning. My answer to this, the best time to exercise is at a time that's comfortable for you, whenever you can make it a part of your regular routine. There's research that shows that your body will adjust to whatever time of the day works for you. Those who advocate a morning workout claim that while you're sleeping, the 6 or 8 hours that you are sleeping, your body has used its carbohydrate stores stored primarily in the liver. And now when you start working out, you can bypass those carbohydrate stores and get straight to fat. There's probably some truth to this, but there's really no scientific studies that have proven this. Other studies also suggest that morning workouts may help you actually sleep better in the evening. A lot of people talk about the adrenaline rush that takes place if you work out late in the day or in the evening, which can alter sleep patterns. The important thing is to pick a time of the day that works for you and stick with it. Living in the Southwest and in Texas, water is always essential when performing exertional activity. But is water really better than any sports drinks for rehydrating? I would say most of the time, and for most athletes, water is the best way to rehydrate, especially for normal daily exercises. For those who perform vigorous exercise lasting more than an hour, or even marathon runners, or for example, collegiate athletes that are out in the sun daily, sports drinks can be more effective, if not better. These sports drinks tend to replace some of the carbohydrates and electrolytes that are lost through perspiration. Another question I get is, should I be lifting until my muscles completely fatigue? The answer to this is definitely no. The most important thing when considering strength training is to lift with good technique. So lift slowly, use good form, and have good posture. Bad technique will always lead to injury. Lift correctly, even if it's less weight. There's no reason to show off. In addition, weight training builds tone, and muscle is more metabolically active. A lot of females ask me, will I become bulky? Will I look like one of those bodybuilders in bodybuilding competitions? The answer to this is, unless you're taking supplements, probably not. Women have quite a bit of estrogen that often will prevent them from developing huge, bulky muscles. Strength training definitely helps decrease spot, and so while you can increase tone, you won't become bulky. Lifting weights will actually increase muscle mass and burns calories a lot more efficiently. The famous saying, no pain, no gain. While there's some truth to this, I think most people will take this to an extreme. The most important thing to remember is that exercise doesn't have to hurt. Start slowly. It's a gradual process. Feeling some discomfort is okay. Muscle soreness is very, very normal in the beginning and can often manifest 24 or even 48 hours after you've started working out. However, if the pain is severe or you become lightheaded, you should obviously stop exercising until it goes away. If your pain doesn't subside, you should see your doctor again before you start working out again. So what are some of the risk factors for injury? I think the most important thing to say about this slide is that we should try and prevent injury. Excessive duration, intensity, and frequency of exercise should be taken into account. The weather and different types of terrain, incorrect equipment. For example, if you're a runner, changing your shoes frequently. Any prior injuries, you should make note of those. Whether you smoke or not. What type of lifestyle do you lead? What type of exercise are you interested in doing? Are you interested in doing low aerobic or really muscle endurance and strength training? You want to maintain good flexibility, a balanced strength, and also keep in mind what other musculoskeletal conditions that you may have that may predispose you to injury. For example, if you know that you have some thinning of your cartilage or a prior meniscus tear or repair, an ACL reconstruction, any other injury that may predispose you to an injury. What are the most common injuries? So these include sprains, strains, stress fractures, tendinitis, muscle cramps, and spasms. A lot of patients ask me, well, what's the difference between a sprain and a strain? Ligaments undergo sprains and muscles undergo strains. So that's probably the biggest difference. Whenever we talk about strains, we're talking about a muscle injury, and whenever we're talking about ligaments, we're talking about sprains. I can't emphasize the use of proper equipment. Most of these injuries are often due to overuse or because of improper equipment. So as I had mentioned before, if you're a runner, replace shoes as they wear out, wear comfortable, loose-fitting clothes and that are light enough to release body heat, and also dress in removable layers, especially in the cold weather. While this slide is very intuitive and obvious, a good warm-up can prevent injury. Warm up prior to any exercise, even before stretching. This will often loosen your muscles, tendons, ligaments, as well as the rest of your joint, and increases blood flow to your heart and blood vessels. A balanced program is essential. When trying to figure out a good exercise program, develop a balanced fitness that incorporates cardiovascular exercises, strength training, and flexibility. In addition, you should try to provide, in addition to providing a total body workout, a balanced program prevents you from getting bored and lessens your chances of injury. Stretching is extremely important to prevent muscle injury. This allows the muscle to take on a significant amount of stress prior to any injury. Correct stretching technique involves holding the stretch for a 10 to 20 second count and then slowly and carefully releasing it. You really don't want to bounce when you're stretching. During your exercises, take your time. There's no need to rush through these. Move through the full range of motion with each repetition and have good technique. Try and control your breathing. This helps lower your blood pressure and increases blood supply to the rest of your body. Hydrate, hydrate, hydrate. There's a lot of literature that supports how much water should be ingested by individuals. I think most of us know that we should drink about 6 to 8 glasses of water a day, so if you're working out, clearly you need to take more than that. A cool-down technique is also very important when considering working out. You should make this the final phase of your exercise routine. It should take about as long, if not a little longer than your warm-up. Slow your motions and lessen the intensity approximately 5 to 10 minutes before stopping completely. And the other important part of working out is actually getting enough rest. Schedule certain days off from exercise and rest when you're tired. Fatigue and pain are good reasons not to exercise. So when should you not exercise? Obviously, if you're feeling ill, so if you have a fever or any sort of infection, when you have any sort of GI irritabilities, these can lead to dehydration. In addition, any sort of cardiovascular problems such as chest pain, this can be a warning sign of something very serious, so you should see your physician right away. So are you ready to start exercising? Most people are. Check with your health care provider first, especially if you have any underlying medical conditions. This is particularly important if you're over the age of 65, taking any prescription medications, or have any long-term health conditions such as heart disease, diabetes, or arthritis. Remember to consult with a physician if you have any systemic signs such as dizziness, shortness of breath, chest pain, or any numbness, tingling, or shooting pain into your extremities. We'd like to now start a question and answer session. If you have any questions, please feel free to send them in to us. So our first question is, what is the recommended recovery time between exercising the same muscle? For example, I run 4 miles on Wednesday morning. When can I run 4 miles again? This is a great question. Whenever patients or athletes have pain or soreness after an exercise, I usually try to quantify it. Usually if the pain is rated between a 2, maybe a 3 out of 10, I think it's probably safe to continue working out that muscle. If that pain is moderate, in between a 5 or 6 out of 10, I would wait until that pain level comes down. So if you ran 4 miles on Wednesday morning, when can you run 4 miles again? Well, I would say as soon as your pain is between 2 and 3 out of 10. The next question we have is, can you do aerobic exercises in the morning and resistance in the afternoon? I think that this would be absolutely satisfactory. Again, you'd want to target what your goals are. So again, if your primary goal is endurance and cardiovascular training, I would probably focus more on the aerobic exercises. The resistance training in the afternoon is primarily for muscle tone, which would be very, very acceptable. The next question is, how long should a cardio workout last to burn a good amount of calories? This is a very good question. If you remember the slide about morning workouts, your liver is the primary storage of glycogen, which is a carbohydrate store. So most people would recommend that you start doing some sort of cardiovascular exercise for at least 15 to 20 minutes before you will really see a difference. This obviously depends on the intensity, how long you've been working out, and what type of shape you're already in. But I think a general good rule of thumb would be probably about 15 to 20 minutes before you are actually starting to burn a significant amount of calories. The next question is how many days a week or hours per week should you exercise? Again, this depends on your goals. If your goals are really just to try and lose a few pounds, maybe get a little bit more toned, I think how often you work out is really up to you. The next question is what do you think about Bikram yoga? The instructors state that the heat in the room helps to relax the muscle and extend the stretch. However, it seems that there is a higher risk of dehydration. This is absolutely true. Yoga has really become very, very popular in the last 5 to 10 years. While the heat in the room does cause some dehydration, I think hydrating yourself prior to this exercise as well as afterwards is essential. Bikram and other types of yoga are very popular because they not only focus on stretching and elasticity, however, they also help strengthen your muscles. So you're pretty much doing a 2-for-1 exercise program. Next question is as a beginner, is there a type of exercise that would be best for me to start with? Again, I think that this depends on what your goals are, what your body habit is. As a general rule, most people would say you should probably start on some sort of cardiovascular exercise, something that's non-impact, either biking, an elliptical machine, or even walking or a light jog on a treadmill, and progress from there. The next question is what's a good rule of thumb for how long your cardio exercises should be for weight loss? 30 minutes a day, 5 days a week, 1 hour a day for 5 days, less or more? I think for weight loss, I think exercising between 30 and 45 minutes a day, between 4 and 5 days a week would be very healthy. I think more importantly, a good dieting program is probably essential. Most people think that if they just work out, they'll end up losing weight, but the problem is once you start working out, you become a little bit more hungry and you tend not to watch what you eat when you should. Next question is I hear people say muscle weighs more than fat. A pound is a pound, whether it's a pound of feathers or a pound of lead, right? This is absolutely correct. What I think people are referring to is that muscle is more tone, you can see it, and probably density-wise, it's more than fat. Next question is when strength training, is it safe to work the same muscle on a continuous basis, or should there be a pause and concentrate on another muscle? I think when considering strength training, a balanced strength training program is essential. So, for example, for those people that want to focus on chest, doing bench press, incline, dumbbells, butterflies are all important, but this should be balanced with some sort of back strengthening program such as rows, pull down exercises, and even chin-ups. Will working out more increase your appetite? I think working out will definitely increase your appetite. As you tend to burn more calories, you'll need to ingest more in order to balance out the loss. So yes, working out will increase your appetite. Next question is tell me your thoughts on interval training on the treadmill. Sprinting, I find sometimes that my walking regimen keeps me at a plateau with weight maintenance and weight loss. I think interval training is very important. A lot of people talk about shocking the body because your body will get used to doing the same exercise over and over again. Interval training, I think, is very good on the body. I think it's very good in terms of an exercise program, and I think people see better results with interval training as opposed to the same type of training day in and day out. Another question is that my kid's track coach tells him to run a bit to warm up the muscles before stretching, saying cold muscles should not be stretched. What are your thoughts? Well, I think in the cold weather, it's absolutely important to start to warm up your muscles before you even start to stretch. Warming up the muscles with a light jog will increase blood flow to the muscles and make stretching easier. The next question is what are the thoughts on video workouts like Zumba and P90X? I think these are all good workout routines. I will say that if anybody works out for 45 minutes straight at that intensity, regardless of which workout you're doing, you're going to lose weight and put on muscle.
Okay, we have a few more minutes with Dr. Shaw. If you want to go ahead and submit some questions, we'll give you a second. But we will be having a hard stop at 12:30 today.
The next question is a cardio workout on a treadmill or elliptical just as effective for weight loss as running? As an orthopedic surgeon, it's my job to advocate non-impact exercises. I think a cardio workout on a treadmill or elliptical can be as effective as running. However, I think the athlete or the patient should be very cognizant about setting the resistance and the speed on each of those so that you can match that type of intensity as is seen with running. The next question is I'm a diabetic, and how do I start a balanced exercise program with my blood sugar levels in mind? Well, I think that this depends if you're an insulin-dependent diabetic or a non-insulin-dependent diabetic. I would definitely consult with your endocrinologist about where your blood sugars are. The other important caveat is at any sign of lightheadedness or dizziness or chest pain or any other systemic signs, you should stop and consult your physician. I think a balanced exercise to start off with would be a stationary bike or a walking program. The next question is it necessary to stretch before you run, say a 3-mile run, or afterwards? I think it's important to stretch before and after your run. Is it okay to work out for a length of 2 hours? I think 2 hours is probably pushing it. There's a lot of people that work out for more than 1 to 2 hours a day, and that's probably excessive in my opinion unless you are specifically training for a marathon or some sort of organized activity. What are the best snacks to eat before a workout? In general, something very, very light is probably the best thing to eat before a workout. A lot of products exist, such as workout bars and various fruits, but most people tend not to eat right before a workout and tend to eat after a workout.
Okay, well, it looks like the questions have stopped coming in, so we're going to go ahead and bring the presentation to a close. Thank you so much, Dr. Shaw, for joining us today. And thank you to everybody who tuned in. Please join us in March when gastroenterologist Dr. Sheila Chandra will be presenting Prevent, Beat, Treat, Beat, okay, I'm going to get this, I promise. Prevent, Treat, Beat Colorectal Cancer in recognition of Colorectal Cancer Awareness Month. And go ahead and register right now. It's the link to that is Kelsey-Seybold.com/webinars. And also don't forget to look us up on Twitter, Facebook, and YouTube. Thanks again, Dr. Shaw. We really appreciate you being here.